Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I want to thank you and welcome all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions in the GoToWebinar chat box. MS navigators are online throughout today's program, answering questions and connecting you with resources. As we get started, I'd like to acknowledge and thank today's premier national sponsor, EMD Serono. Support from MS community partners helps the MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Appropriately enough, August is National Immunization Awareness Month. It's a month when public health officials remind us of the importance of vaccination for people of all ages. Many people living with MS have concerns about the safety of routine vaccinations and lately, more specifically, the COVID-19 vaccines. Today, we're talking about vaccine-preventable infections and vaccine recommendations for people living with MS. And we'll update you on the COVID-19 vaccines and boosters and share the most accurate and reliable guidance available to help you make informed decisions. I'll be joined today by two experts. Dr. Nancy Psychot is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles, California, where she's also the Women's Guild Distinguished Chair in Neurology and Director of the MS and Neuroimmunology Program. And Dr. Psychot chairs the National MS Society's National Medical Advisory Committee and leads its COVID-19 Vaccine Advisory Group. Victoria Holmes is a nurse practitioner who specializes in pediatrics. Victoria received her Master of Science in Nursing from the University of Pennsylvania and is currently pursuing her Doctor of Nursing practice degree. Victoria's dedication to nursing and her passion to serve her community is what motivates Victoria to push beyond her limitations. Victoria first presented with signs and symptoms of multiple sclerosis at the age of 18, and she was diagnosed with MS 2 years ago at the age of 29. Like some others living with MS, Victoria was initially hesitant to receive the COVID-19 vaccine. Welcome, Vic. I want to thank you for joining us for this very important discussion.
Thank you for having me, John.
Before we talk about your experience with the COVID-19 vaccine, can you share what the first couple of years since you were diagnosed with MS have been like for you?
Absolutely. My journey with MS has been quite a roller coaster since being diagnosed. Life started to change pretty rapidly, and I felt like I didn't have much control over it. As mentioned earlier, looking back over the years, I experienced symptoms since about the age of 18. In school, I would have trouble reading or keeping up with everyone else in the classroom, and I would have to spend way more hours in the library than anyone else. And also I had some numbness as well. It wasn't until 2019, though, that I had a flare that really left me with continuous numbness and tingling in both my arms and both of my legs. And then I started having trouble walking. My arm would go completely dead while at work. It felt like dead weight just hanging off of my shoulder, and I couldn't move it. And the most hurtful thing for me was that I developed pretty significant changes in my cognition. My thought processing speed is now very delayed, It takes me much longer to catch on to information. My memory is non-existent. It's terrible, terrible brain fog, no longer able to multitask. It's devastating. I used to pride myself on academic achievements, but after all of those flares, I felt, for lack of better terms, kind of stupid and embarrassed. I went from being a thriving MP to now being a patient myself. And so, of course, then came the depression, and I'm still grieving the loss of control over my body, loss of control over my mind, my life, my career. I'm only 31, and I feel like I'm kind of losing it all. And I kept having relapses and symptoms. They were getting a little out of control. I had 2 different meds that I tried, and they both failed. So now I'm on Ocrevus. And while on Ocrevus, I've been without lesions for the past 5 months so far. And then, of course, COVID hit, and I'm an MP. So, of course, I advocate strongly for vaccination. But now I'm a patient, and I'm immunocompromised. And I already don't have control over what's going on with my body. So do I really want to take the risk of taking this new vaccine? So that's where my vaccination hesitancy kind of came into play. How could I, as a healthcare provider, advocate for vaccinations when I didn't even want to get it myself?
And I know since that time, you've actually been vaccinated. What changed your mind?
So really, my fear of getting vaccinated kind of flipped. It shifted from what if I do to what if I don't. The world was opening back up, and I realized I had no protection over this virus. But I did want more information. My doctor, of course, pushed me to do it, but I needed more information from not just my doctor saying do it. So I started to look up things for myself. Of course, there was information and feedback from social media that didn't really seem reliable, but I found some really good sources like the CDC to kind of answer my questions. And what I found completely changed my mind, really put me to ease. And that kind of sparked me even to go back to school, as you said, that I'm a doctoral student. Just finding all this new information from reliable sources really opened me up to the idea of actually getting vaccinated. So I did get vaccinated back in April.
And which vaccine did you receive?
I received the Pfizer vaccine, my first and second dose back in April.
Did you experience any side effects from the vaccine?
Actually, just fatigue, not anything more than that. I think, if anything, I psyched myself out. I was bracing for more of a response, but nothing happened, just a little tired.
I think we all know someone who's experienced side effects after getting the COVID-19 vaccine. How do you help others feel less anxious about those side effects?
Well, I say feeling anxious is normal, but there's a great deal of information on the CDC website about the percentages of people who've had reactions versus mild versus major. And if you look on the website, you'll probably see that most of the reactions are mild, and hopefully that'll help you with the anxiety of getting the vaccine and experiencing side effects of your own.
So what advice about the vaccine specifically do you have for people who are living with MS?
I'd say better safe than sorry. We see that the vaccine has helped lower the case of mortalities with COVID. I'd say also, if you have any questions, don't hesitate to look up information, ask your providers, see what reliable sources are out there, and that gives you the power to make a well-informed decision on whether or not you want to move forward with the vaccine or not.
So what do you think is the best way to encourage members of the MS community to do exactly what you say and be safe and get vaccinated?
I honestly think that the biggest thing we need to do is acknowledge the fear that we have out there. Acknowledge the fear and provide facts. I know that we have a lot of hearsay out there about what could happen with the COVID vaccine, but what are the facts? And that is what we need to get out to the community so that we can not live in fear and live off of facts and make well-informed decisions based off of that.
Well, thank you for sharing your story, Vic. Before I invite Dr. Psychot to join us, I'd like to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box on GoToWebinar. MS navigators are online throughout today's program, answering your questions and connecting you to resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. I'd also like to remind everyone that COVID-19 is a new coronavirus, and the published data available about this virus and MS are limited. The information and recommendations presented in this program are based upon individual professional opinion of MS experts and the evidence currently available about MS, COVID-19, vaccines, and disease-modifying therapies. The information that is shared does not substitute for your healthcare provider's recommendations. Please check with your healthcare provider before making any changes to your treatment plan. As we move through the COVID-19 pandemic together, the health and safety of people living with MS and their families is our top priority. We've seen that experts are learning about COVID-19 in real time, and new information about the virus seems to be in the news almost every day. Today, we'd like to share some facts that you can rely on in making the best decisions for yourself and your loved ones. And to do that, I'd like to invite Dr. Nancy Sicotte to join us. Thank you for being with us today, Dr. Sicotte.
Good morning, John. It's my pleasure. We meet again.
We do. Well, let's start with the two questions that we continue to receive. Are the COVID-19 vaccines from Pfizer-BioNTech, Moderna, and Johnson & Johnson safe for people with MS? And should people with MS be vaccinated against COVID-19?
So, John, the answer is the same. We have lots of new information. We accumulate information over time, and we see that these vaccines are both safe and effective, and we absolutely recommend them for all of our patients living with MS.
The National MS Society's expert advisory group that you lead has developed guidance for people living with MS and in making decisions around the safety and timing of COVID-19 vaccines with certain disease-modifying therapies. Does the vaccine advisory group recommend one vaccine over another for people living with MS?
So we have not come out to recommend one vaccine over another. The information that we have shows that all of the currently FDA-approved therapies or vaccines that have the emergency use authorization are effective in preventing severe COVID, keeping people out of the hospitals, and keeping them from dying from COVID-19. So we don't recommend any one specifically.
Amanda wrote in asking if she's at increased risk for getting COVID-19 because she has MS. What would you say to Amanda?
So this is a great question. It was a question that we had at the beginning of the pandemic. We were quite concerned because we didn't have information about whether or not people who had MS, whether that was a risk factor for developing COVID. And it turns out that it's not. So having MS in and of itself does not increase your risk for getting COVID. There are certain patients who live with more severe disability from their MS who are at increased risk for having poorer outcomes if they do happen to contract COVID. And as I'm sure we'll talk about, some of the disease-modifying therapies that we use to treat MS can decrease the effectiveness of the vaccines and potentially increase the risk for more severe COVID. But MS in and of itself is not a risk for developing COVID.
Well, I'm glad you brought up those disease-modifying therapies that may have an impact there. Let's talk about the Society's guidance regarding vaccinations, COVID-19 vaccinations, and disease-modifying therapies. Now, most DMTs are not expected to have any effect on the efficacy of the COVID-19 vaccines, but as you pointed out, some may make the vaccines less effective. What are some of the disease-modifying therapies that may affect vaccine effectiveness?
Thanks, John. I think this is a confusing topic for people. So I want to make sure that we emphasize that we're talking about efficacy with these of the vaccines, not safety. So there's no concerns about interactions of the vaccines with disease-modifying therapies that individuals might be using. But in regards to how robust an immune response and how robust a protective effect that you might develop from the vaccine, that can be impacted by certain disease-modifying therapies, as you mentioned, in particular the ones that we call the B-cell depleters. So that would be ocrelizumab, rituximab, and now ofatumumab. These are drugs that decrease the numbers of these B cells, which are very important for part of the vaccine response, not all of it. And then there is some evidence that another class called S1P inhibitors, like fingolimod, siponimod, that these also, people have shown that antibody responses at least are diminished if individuals are using those medications. And then finally, alemtuzumab, which is another monoclonal antibody, also depletes B cells, and so would be expected to potentially decrease the responsiveness that you might have to the vaccines. But I do think it's important to emphasize we have more data now showing that those antibody responses are not the only part of the immune response to the vaccine. And Amit Bar-Or and his colleagues have just published a very important study, and Dr. Bar-Or is part of our vaccine advisory committee. And he's demonstrated that while those neutralizing antibodies that we are constantly thinking about and some people are having measured, those are important. They're not the only part of the immune response that gives you protection from the virus. So there's another whole group of cells called T cells, and the T cell responses are also really important for vaccines. And those T cell responses actually seem to be absolutely intact in those people who are taking B cell depleters like ocrelizumab or rituximab. So I think that's really, really good news. It's a sort of a piece of data that we've been missing. And it is also to emphasize that it is very important and it is useful to get vaccinated, even though you might think that your response as measured by those antibodies isn't as pronounced as you would as it would be if you weren't on those therapies. That was a long answer.
And actually it was well timed. We received a question from Liam, who sort of exemplifies the case you just generally talked about. He's on Ocrevus. He said that his doctor ordered a COVID-19 antibody test 4 weeks after receiving his second dose of the Pfizer vaccine. And the results of that antibody test indicated that Liam had an undetectable level of antibodies. And he wanted to know why his immune system failed to produce those antibodies.
Yeah, and this is a great question. And this is, of course, what we have been thinking about and wondering about because of the way those drugs work. They are eliminating a class of cells, those B cells, and those B cells are typically the ones that get turned on and actually develop into antibody-making cells called plasmablasts and plasma cells. And so it's not surprising, I guess, that you would not necessarily see that there were antibodies that could be detected, those neutralizing antibodies. But as I said, this new study demonstrates that T cell responses are normal or maybe even a little bit more robust in individuals who are on drugs like ocrelizumab. So it is still useful to get the vaccine. And then I think it also demonstrates the other point, which is, I think, confusing and hard for folks, but we are not using those antibody tests to decide whether or not somebody has had a full response to the vaccine. And the FDA does not recommend using those for clinical decision-making. However, I think we'll probably be talking about the newest hot topic soon, which are these booster shots. And that may be an opportunity to suggest that you might benefit from a booster if you have been vaccinated and find that you don't have any antibodies.
We're going to get to those boosters in half a second. I just had one more question for you. Given what we've been talking about regarding some of these specific disease-modifying therapies, is it important for someone to coordinate the timing of their vaccination if they're on some of these specific DMTs so they gain the best possible vaccine response?
So that's a great question. And we've spent a lot of time on our advisory panel thinking about this and trying to find, good scientific data to support our recommendations. So it is limited, but what we do know is when the longer you go, the longer you wait after you've had your infusion, the more likely you are to have a stronger response to the vaccine. So we have recommended waiting, if possible, 12 weeks after your infusion and then getting your vaccine. What we've also seen from Dr. Baror's paper is even though we're not detecting B cells that are in the blood samples that we might be looking at, the longer you wait after that infusion, the more robust your immune response will be. So when at all possible, waiting as long as you can after your last infusion, but a minimum of those 12 weeks is what we've been recommending. And then on the other side, it's important to note that you should wait at least 4 weeks after your last shot before you go and get your next infusion of your B-cell depleter. So the timing can be complicated. I do refer people to our advice, which is on the website, the National MS Society website. But we're feeling more confident now that waiting that 4 weeks after you have your last vaccine will help boost or bolster your vaccine response. So that's our current advice.
Sorry about that. We've been talking about guidance for people who are on disease-modifying therapies, but should people living with MS who are not on disease-modifying therapies be getting the COVID-19 vaccine?
Well, John, I think you and I both know the answer to that question. Everybody should be getting the vaccine. I think, if anything, what this Delta variant has taught us is letting the virus run around rampant throughout the population is just like a crapshoot. We could end up with worse variants. We need to stop transmission because every time the virus gets into a new host, a new person, there's a potential that it could turn into something more virulent, more infectious, and so forth. So everyone should be getting the vaccine, and that includes people who are on disease-modifying therapies or not. Everybody should be getting the vaccine.
This week, it was announced that people age 18 and older who have received 2 doses of an mRNA vaccine, that is either the Pfizer-BioNTech or Moderna vaccine, those people are eligible to receive a COVID-19 vaccine booster beginning in September. Now, additionally, it was announced that people with MS age 12 and older who are fully vaccinated with the Pfizer-BioNTech vaccine and people with MS age 18 and older who are fully vaccinated with the Moderna vaccine may be eligible to receive an additional vaccine dose now. So what can you tell us about this booster and its implications for people living with MS? Who should be getting an additional dose of the vaccine now?
So great question, and a little bit nuanced in terms of answering specifically. So I think we want to differentiate between people who would benefit from an additional vaccine dose and those of us who have had the 2 shots, but now time has gone by and we need a booster. So they're a little bit different, but the idea is the same, is that we're trying to get more protection from the virus as we see over time that especially this Delta variant is so easily transmitted. So for certain individuals who are on immune suppressing medications or who have immune compromising conditions, data now shows that they are at an increased risk for getting infected with COVID and even getting severe infections with it. So this would be people who've had bone marrow transplants, who have had organ transplants, and who are on certain medications. And those certain medications include medications that people living with MS are taking. In particular, as we talked about, those B-cell depleters, the S1P inhibitors. So those individuals would qualify under this new guidance to have an additional vaccine shot. And I guess we can call it a booster. Again, a little bit different than the boosters that will be coming in September. But you would be eligible for an additional vaccination. And this has been shown to increase the response to the vaccine and provide additional protection. So the recommendation is that it has to be at least 4 weeks after you've had your last shot. But if you are on one of these B-cell depleters or on one of the S1P inhibitors, this would be, I think, something you should take advantage of to really give yourself an opportunity to have a more robust vaccine response and to be safer from severe COVID. Now, for the rest of us, it looks like starting in September that individuals, like a lot of healthcare professionals who had their vaccines in January, will be coming sort of to this 8-month period where now data is showing that some of the immune response is waning a little bit. And we see these so-called breakthrough infections, people who've been fully vaccinated ending up getting infected and having symptomatic COVID. But I want to emphasize, we really do see the vaccines are doing what they're supposed to do, which is keeping people out of the hospital and keeping them from dying from COVID. And so we do see more people getting these breakthrough infections, but they're mild for the most part, and people recover quickly. So the vaccines are working, but it may be that we just, as we come into the winter months in particular, we want to, I think there's concern that we want to really knock this thing out by giving this extra dose to people who are fully vaccinated already.
I've read that among people who are experiencing breakthrough infections, many of them tend to be immunocompromised individuals. And I know the booster was initially approved for certain immunocompromised people. Now, does having MS mean that you're immunocompromised?
Yeah, so I think we talked about this at the beginning, and the answer is no. Just having MS does not make you immunocompromised. Your immune system is different. You have an autoimmune disease, but in some ways your immune system is overactive. And that's why we use medicines that suppress immune function in order to treat MS. So we don't think of MS per se as an immune compromising condition, but sometimes the treatments that we use will result in a patient having immune compromise.
And I think this is something you've answered in a slightly different way already, but the answer is probably worth repeating. You mentioned that people with MS using certain disease-modifying therapies may benefit from a third dose of the vaccine now. Now, what about people who are on other disease-modifying therapies or who don't take any disease-modifying therapy?
Yeah, so this is a great question. I do think it's worth a conversation with your healthcare provider. So we do know that certain medications that people take for MS don't seem to be affecting vaccine responses at all. So that would be the interferons, which actually may provide some protection. Copaxone, Tecfidera, a lot of the medications that people are using for MS. When we look at vaccine responses, there's no evidence that those vaccine responses are diminished. Now, there could be other situations where people living with MS on those medications want to get another shot, and it's because they're on immune modulators, they are actually eligible technically per the advice that's been given. So I do think it's worth a conversation with your healthcare provider. If you have other comorbidities, obesity, disability, pulmonary disease, diabetes, this may be putting you at an increased risk for severe COVID in addition. And so having this opportunity to get the third shot might make sense. So in those individuals, I think it's, again, a little more nuanced, and I would definitely recommend a conversation with your healthcare provider or your neurologist regarding it. And then just to give perspective, John, I think, as we were talking about, probably all of us are going to be lining up for a booster at one time or another. So it's just going to be a matter of how quickly people will be getting in line to get that third shot.
And speaking of how quickly, how soon after being fully vaccinated, receiving both doses of the mRNA vaccine, can someone get that third shot?
So right now, the recommendation is waiting at least 28 days, so essentially a month after you've been fully vaccinated, then you would be eligible to get that third shot. And again, really thinking about this in people who are immunocompromised significantly, like we talked about the transplant patients and MS patients who are on these specific classes of medication.
Do we know whether people will be fully protected from COVID-19 after getting this third shot?
Great question. So it's a matter of the statistics. So what they've shown is that individuals who are in these groups that did not respond as well initially had overall about a third of them, I believe, had an increased response. So it's not 100%, but it increases your odds of having more response to the vaccine. But I do think, John, it brings up this other point. Even though we're all vaccinated, or we might be getting our boosters, or people getting that third shot, we do need to keep doing all the things that we've been doing, which is a little annoying and unfortunate, but we need to be wearing our masks. We're doing it in the hospital now for everything, having social distancing, and being really smart about how you get yourself exposed, that you're just limiting your exposure in crowded places, in group settings, and so on. So we just have to keep up that vigilance that we've been doing for the last 18 months for a little bit longer.
We've heard from Alexander, who wonders if everyone who gets a booster will get more antibodies against COVID-19. And he also asked if he should get his antibody level checked before getting that booster. What advice do you have?
So as we were talking about before, the FDA does not recommend using, or the CDC does not recommend using the antibody test for clinical decision making. And so the decision to get that third shot should be made on the basis of the medications that you're on and your overall risk, and a discussion with your healthcare provider. So we are not recommending that people get antibody testing either before or after their vaccines. In research studies, that's being done to try and get, learn more about it. But for an individual person, it's not really going to be used for decision making. And so I would say, and as I was talking about before with the new data that we have regarding immune responses, we also know that those antibodies are not the whole story. Right, so you may see, so say you did that antibody test and it didn't go any higher after you had your booster. It still doesn't mean that you haven't had a benefit from the vaccine, because as we were saying, there are other parts of the immune response that will be stimulated by that additional vaccine and will give you protection. Those include those T cell responses that we were talking about. And those are really not captured in any of the sort of routine clinical testing that's being done. Those measures are only available in a research setting. So based on what we know from the studies that have been done, we would still recommend that people get that third shot if they're eligible, and with the hope that they will have an increased response and increased protection from severe COVID.
Miranda wrote in saying that she experienced some side effects after her second dose of the vaccine. And she's wondering whether people who experience those side effects with the first or second dose, and if they get the booster, can they expect side effects from that third shot?
So it's a great question. I'd say the likelihood is that they will. We know that after vaccines, especially if you've had them previously, you get this sort of memory response. And that's why typically that second shot is a little more uncomfortable. A good question, given that time has gone by and that the immune response seems to diminish a little bit. I haven't seen a lot of data about how frequently that third shot gives people side effects. I would assume that it would, but again, we know these are mild, they're self-limited, and for people living with MS, they may experience a transient increase in their MS-related symptoms, as happens typically if you have a fever or if you if your body temperature goes up, those sorts of things tend to make MS symptoms a little bit worse, but it's a transient situation, and taking lots of fluids and taking some, over-the-counter analgesics typically will get you through that, and then you'll carry on and you'll have that additional protection. So it'll be worth maybe a day or two of not feeling great.
We've already talked about the importance of timing your vaccination with some disease-modifying therapies. Does timing the booster with your DMTs matter as well?
Yes, it's the same principle. So we would definitely, when possible, try and get your booster done before and as far away from your last infusion as makes sense as possible. And then to avoid getting another infusion of your B-cell depleter for at least 4 weeks after you get your booster. So it's really the same principles as we laid out for the initial vaccinations, that you want to wait at least 12 weeks if you're on one of those every 6-month infusions. Try and wait 12 weeks if you can before you get your first shot. And then try and wait 4 weeks after your last shot before you do your next infusion. And that gives your immune system the best opportunity to respond robustly to the vaccine. And that principle holds for the booster as well. And then the only additional caveat about the booster is if you're just getting vaccinated now, you have to wait at least a month after your second shot to get your third shot. So it could be like a 3-month thing if you're doing all 3 at once.
And what about people who received the Johnson & Johnson vaccine? Has the FDA authorized a 3rd shot for them?
So this is a great question, and I think probably a frustrating question for people who got the J&J vaccine, because there is no data. I heard this morning on my way in that they are collecting data and they're going to make it available. But right now, there is no approval, emergency use or otherwise, for boosters with the J&J vaccine. And I think it's important to remember that they are different. The J&J uses a DNA vaccine, whereas the other 2 are mRNA. And DNA tends to last a little bit longer and has different immune responses. So it may well be that there'll be evidence to support a booster for J&J, but we're just not there yet. And so the FDA has not authorized that.
The FDA has issued an emergency use authorization for Regeneron's antibody cocktail for emergency use as a post-exposure treatment for COVID-19 in adults and youth 12 years of age and older who are at high risk for progression to severe COVID-19, which includes hospitalization or death. Now, is this preventive monoclonal antibody treatment a substitute for a COVID-19 vaccination?
So absolutely not. But I do want to emphasize that this is a really important opportunity or tool that we have in our toolbox, because as we've seen, this Delta variant is rampant, and it's possible that people who are living with MS, who are staying home and who are being very cautious, live with other people who have to go out of the house. We know, people who are essential workers. I have to come to the hospital every day, and I worry about this, in terms of bringing it home to family members. So for people who are living with MS or other vulnerable people who get exposed and who are at high risk for potentially getting very sick, this is a really nice, opportunity that is now made available. So if I really want people to know that this is an option for them, if they've been exposed and they're at high risk, they can now get this monoclonal antibody to prevent them from getting sick and keep them out of the hospital. So something to consider. And also for individuals who do get sick, who are in the early stages but have risk factors for having severe COVID, they also have been and still are eligible to get the Regeneron monoclonal antibody. And they should take advantage of that because it is very effective. You remember our ex-president was at a very high risk and was really seriously ill, received the Regeneron, and within 2 days was back out at it. But we see that this is can be very effective, so people should know that. Now, to your point, it is not to replace the vaccine at all, because again, it's complicated, it's expensive to give this monoclonal antibody. You have to have access to it. You have to go to an emergency room at least to have the infusion. So we certainly don't recommend it as a first line preventative. But in those certain circumstances where people have been exposed and they are at high risk, they should absolutely take advantage of that as a way to prevent severe illness with COVID.
And I'll ask you the same question I asked regarding boosters and disease-modifying therapies. Is this Regeneron treatment recommended and safe for people with MS who are on certain disease-modifying therapies, or are there some specific considerations they need to understand?
So monoclonal antibodies do interact with each other. So but they tend to be diminished within the bloodstream relatively quickly. So there's a possibility if you had just gotten your infusion a day or two before, and then you're exposed to COVID and you're going to get the Regeneron, there could be some interaction there between the two monoclonals. But in general, that's a very rare circumstance. And so there's no safety issues. It would be more of an efficacy concern regarding that. So no interaction other than you wouldn't want to be infusing them at the same time because they could counteract each other.
Well, we know that the CDC monitors the COVID-19 variants that are identified, and you've mentioned the Delta variant a few times already this morning or afternoon. What can you tell us about the new Delta variant?
So the Delta variant, as we've seen, is very, very infectious. So it's, I've seen different numbers, but at least 10 times more infectious, transmissible than the Alpha version, so the original virus. So what this means is in a setting where maybe 1 or 2 people who are exposed would get infected, now 5 or 6 people who got exposed will get infected. People carry more virus in their nose and in their mouth, and so they're spreading more virus, and the virus itself is easier to contract. So it really is emphasizing how we need to be wearing our masks and staying away from each other and staying out of these crowded, environments that with poor ventilation, because that virus is out in the air and you can breathe it in, and it only takes a small exposure to come down with it. The other thing that we've learned is that even people who are vaccinated, I think we talked about this at the very beginning about vaccines, whether vaccinated people can transmit the virus. And it turns out that they can. And it turns out because of this Delta variant, even vaccinated people who are either asymptomatic or only mildly sick are carrying large amounts of virus in their nasal passages and in their mouth. And so they are able to transmit it to other people. And so this is, again, why everyone really needs to be vaccinated, because we're hoping that the vaccinated people would sort of be a stop on transmission. But it turns out with this Delta variant in particular, vaccinated people can still transmit the virus. And that's why we have to keep wearing our masks, which again is frustrating. But again, I want to emphasize, vaccinated people are not dying from the virus. They might get sick, they might be sick for a couple of days, but they're not going into the hospital, and they are not dying from the virus the way people who are unvaccinated are. That far and away, this Delta surge is a surge of the unvaccinated. And John, if you'll indulge me, I just wanted to talk a little bit about that super spreader event that happened in Provincetown. I happen to be from Massachusetts originally, and I've been to Provincetown, and I know what a great fun place that is. But we heard about that, over 800 cases of COVID that was diagnosed, and these were among individuals who were all vaccinated, who went to these events. It was over a couple of days or a couple of weekends. But what we didn't hear is that there were 120,000 people who descended upon Provincetown for that weekend. And while there were many cases, there were only 7 individuals that ended up being hospitalized, and none of them died. So if you look at that, some people said, oh, this means that the vaccines are not working. But truthfully, the epidemiology shows you that this is a classic case of the vaccines actually working as they should and protected people from dying from COVID.
Thank you for sharing that. Besides the Delta variant, are there any other variants that warrant concern?
So I have heard word of a Lambda variant, although I have to say I don't know too much about that. We haven't, I think what people should recognize is that as the pandemic goes on, and as long as there is continued transmission, widespread transmission among the population, we are at risk for these new variants developing. And again, is another indication of why we all need to be very vigilant and to get vaccinated. But there's some scaremongering about, I think I saw the Lambda variant that was like the terrible variant, but I haven't seen any credible information about that yet.
As you've already mentioned, the CDC has updated their mask guidance, stating that to maximize protection from the Delta variant and prevent possibly spreading it to others, vaccinated people, as you've mentioned, should wear a mask indoors in public if they're in an area of substantial or high transmission. What does this mask guidance mean for someone living with MS? Are there any special considerations that they should be thinking about?
Yeah, I think when you're living with MS or any chronic condition, you should just be more vigilant, and you should be wearing your mask pretty much all of the time when you're around other people who you don't know, you don't live with, and you don't know their vaccine status. Here in Los Angeles, we were pretty quick to put masks back on after the Delta variant started to surge, and we have had, knock wood, we haven't had a surge, but it is not anything like what we're seeing in some other states. So I think for MS patients, they should just be thinking all the time about being that extra bit of caution. If you can get your groceries delivered, have them delivered. If you, if you're going to go out and be outside or go out for dinner, wear your mask as much as possible. I think it's just a matter of that extra vigilance because you're living with a chronic condition.
America is heading back to school, and the CDC now recommends universal indoor masking for all teachers, staff, and students, regardless of their vaccination status. But we heard from Destiny, who's a teacher who lives with MS, and Destiny is fully vaccinated. She wonders if she's going to be safe at a school where unvaccinated children or unvaccinated teachers may not be wearing a mask.
Yeah, so this is a tough one. These are evolving situations, and I think what we're seeing is more and more there will be requirements for students and teachers to wear masks. There will be requirements for people to be vaccinated, and there, in the absence of that, or even in addition to that, there will be weekly testing. So I do think, unfortunately, if this individual is in a classroom setting and there are unvaccinated children not wearing masks, it is very likely that there will be, potential for viral spread. So in this circumstance, my recommendation would be wear the best possible quality mask that you can, and include a face shield to protect your eyes and to give you extra protection on your nose and mouth. And then I think the weekly testing of individuals within the school setting would be very important. But I think this is a really difficult issue because we know that children have not been approved for a vaccination. And so there's going to be a certain amount of the population that still could get infected. Usually not too badly, which is good, although we are seeing some kids ending up in the ICUs just from the sheer numbers of infections. So, we're going to have to be living with this during this school year, and I think it's going to be a big challenge for management. So I would say take that extra bit of caution with a good mask and a face shield.
What about testing? Do fully vaccinated people who have COVID-19 symptoms or have been around someone who's been diagnosed with COVID-19, should they be isolating from others, and should they get a COVID-19 test?
The answer, John, is yes, because again, as we know, individuals who are vaccinated can still harbor the virus. They can get sick and they can transmit it. So they should, if there's any question, if you have symptoms, for sure you should be isolating yourself and getting tested. We've seen that here at the hospital. Some of our colleagues actually have contracted COVID who have been vaccinated. They've been tested. They have not been very ill, thankfully, but they are, isolating themselves so they're not passing it on to other people. So again, I think we all need to be aware and alert, and should be thinking about this if symptoms arise to get tested.
Well, since we happen to be in the midst of National Immunization Awareness Month, and we know that the use of vaccines it's a standard part of routine medical care for everyone, including people with MS, there are concerns. And I thought since we're talking today, if you wouldn't mind answering a broader, more general question, and that is, are there other vaccines that people with MS should always or never receive? Or are there any special considerations or recommendations for people living with MS when it comes to deciding which vaccinations they need to have?
So it's a great question, John. And there's always been this concern with an autoimmune disease, if you give a vaccine, that you're going to stimulate the immune system in a way that will lead to a flare of disease activity. And so we have not seen that with vaccinations in MS. So in general, we recommend the usual vaccines that people would get: the flu vaccine, for example, the vaccine against chickenpox, I'm blocking the name of it, against, zoster. We definitely recommend that, because getting one of those infections, we do know getting a viral infection does increase the risk of having a relapse, certain viral infections. Truthfully, we have not seen that with COVID, but so it's much better to get the vaccine. The vaccines are safe. They don't stimulate disease activity in people living with MS. The only caveat is live attenuated virus vaccines, of which there's only a few. Yellow fever is one of those. So we don't recommend that when people are living with MS, because they could end up with an active infection from the attenuated virus. But those are very small numbers. There used to be a flu vaccine that was a nasal delivery system, and that was a live attenuated virus. So we did not recommend that for our MS patients. And truthfully, it doesn't work as well as the intramuscular version. So in general, you should be getting the usual vaccines. So Shingrix, that's the vaccine that I was not getting the name for. So very important to get that vaccine, actually, for people living with MS, because some of the medicines we use can increase the likelihood of having zoster. So we recommend that, and then the usual annual flu vaccines, which are coming up now. The flu vaccine is available. So maybe we'll get our booster and our flu vaccine at the same time. I think that's probably likely, in different arms.
There you go. Well, you've shared a lot of timely and really important information with us today. What would you say are the top 3 takeaways that you'd like our audience to remember?
Thanks for that opportunity, John. So first and foremost, get your vaccine. If you're not vaccinated, you have no excuse. So go get vaccinated now. The second point I would say is, if you're on one of these disease-modifying therapies, in particular that we talked about, the B-cell depleters, the S1P inhibitors, and it's been more than 4 weeks since you had your second dose and you were given an mRNA vaccine, consider getting the booster. This is now available to you, and I'm recommending it to my patients who are on those therapies. And then the third thing I would say is, be vigilant, keep wearing your mask, keep up the social distancing, and we will get through this. We will get past this. And I think we are on our way there. And so just hang in there, and when in doubt, check the National MS Society website or talk to your practitioner.
Well, thanks to everyone who submitted questions, and thank you, Dr. Psychot and Victoria Holmes, for being with us today.
Thank you, Jon.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. To learn more about COVID-19 and vaccinations and third shots and boosters, please visit nationalmssociety.org/COVID-19-information. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections-programs. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Don't just ride, bike MS. Bike MS is more than the ride of a lifetime. Whether you want to cross the finish line in person or take on a new challenge from anywhere, there's a Bike MS event that's right for you. Find out more and be sure to register at bikems.org. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. I'd like to thank Dr. Nancy Sicotte and Victoria Holmes for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us again for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webinar topics. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Nancy Sicotte, Victoria Holmes, and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.